People with diabetes are more likely to have serious complications from COVID-19 for several reasons. First of all, high blood glucose or high blood sugar impairs the immune system's ability to fight off infections. Also, there's an increased environment of chronic inflammation, which affects the immune system in that it's more likely to trigger a cytokine storm or an overreaction of the immune system, which could lead to complications down the line. Chronic inflammation also creates an environment in the blood vessels whereby blood clots are more likely to form. Some of the most common complications from COVID-19 that people with diabetes are experiencing include pneumonia, respiratory failure, and septic shock. Pneumonia is infection and inflammation due to viral illnesses in the lung tissues, and that inflammation can lead to fluid buildup and an immune response that makes oxygenation of the blood difficult. Respiratory failure is a condition where the lungs develop a difficulty in delivering oxygen to the blood. Septic shock develops in patients with COVID-19 due to a body-wide infection from the virus that causes COVID-19. Septic shock signs include very low blood pressure, dehydration, perhaps even some confusion, and fatigue. COVID-19 infection increases the risk of diabetic ketoacidosis. This occurs because the viral illness is a stress on the body, and under that stress, blood glucose levels will rise, which is the body's natural response to infection. In addition, the virus itself can impair the body's ability to make insulin. If there's no insulin around or not enough insulin around, then the body perceives that it can't use that blood glucose or blood sugar as fuel, even though the blood glucose levels are high. Under those conditions, the body makes ketones or acids as an alternative fuel. If the acids or ketones build up in the body, this can lead to dehydration, which can be profound, sometimes even confusion, nausea, vomiting, and electrolyte problems, and medical attention is imperative. Patients with diabetes who are worried about how the COVID-19 pandemic might affect them would hopefully feel not defeated but empowered to take this opportunity to dial in and better control their conditions. This could include having more conversations with their healthcare providers, beginning blood glucose testing if they're not testing already, understanding what better blood glucose levels mean, also controlling other conditions that often go along with diabetes, including overweight, obesity, high blood pressure, and high cholesterol. All of these measures can actually lower one's risk for severe complications from COVID-19.